Is your period pain more than just cramps? Do you feel like doctors don't take your pain seriously? You're not alone. Millions of women struggle with endometriosis, often without even knowing it. In this video, we're going deep into what endometriosis is, the symptoms, why it's so hard to diagnose, treatment options, and what every woman needs to know about her body. What exactly is endometriosis? Endometriosis happens when tissue similar to the lining of the uterus, endometrium, grows outside of it. This can be on the ovaries, fallopian tubes, intestines, and even other organs. Every month, just like the normal uterine lining, this tissue thickens, breaks down, and bleeds, but there's a problem: it has nowhere to go. The blood gets trapped, causing inflammation, scarring, and severe pain. So, how do you know if you have endometriosis? Here are some of the most common symptoms. 1. Severe menstrual cramps that don't improve with painkillers. 2. Pain during or after sex, dyspareunia. 3. Heavy or irregular periods, bleeding more than 7 days. 4. Painful bowel movements or urination, especially during periods. 5. Chronic pelvic pain even outside of your cycle. 6. Bloating and digestive issues, endobelly. 7. Difficulty getting pregnant, infertility. It is important to note that the severity of symptoms doesn't always match the severity of the condition. Some women with mild endometriosis feel extreme pain, while others with severe cases feel very little discomfort. Here's the frustrating part: on average, it takes 7 to 10 years for women to get diagnosed. But why? Doctors often dismiss symptoms as normal period pain. It's often misdiagnosed as IBS, ovarian cysts, or anxiety. There's no simple test, only laparoscopic surgery confirms it. Tip: if your period pain is unbearable and affects your daily life, push for answers. Keep a pain diary and don't hesitate to ask for a second opinion. Some likely causes include: 1. Retrograde menstruation, which happens when menstrual blood flows backward into the pelvic cavity instead of leaving the body. 2. Hormonal imbalances, high estrogen levels may trigger abnormal tissue growth. 3. Genetics, if your mom or sister has endo, you have a higher chance of developing it. 4. Immune system dysfunction, the body doesn't recognize and remove misplaced endometrial tissue. Emerging research has scientists exploring gut health, inflammation, and environmental toxins as potential factors in developing endometriosis. Unfortunately, there's no cure for endometriosis, but there are ways to manage the pain and symptoms. Pain management. NSAIDs like ibuprofen help reduce inflammation. Heating pads and warm baths can relax muscles. Hormonal therapy. Birth control pills, patches, or IUDs can regulate hormones and stop endo tissue from growing. GnRH agonists, like Lupron, put the body into a temporary menopause-like state, but they have side effects. Surgery, is it worth it? Laparoscopic excision surgery removes endometriosis tissue and is the best option for long-term relief. Hysterectomy, removing the uterus, is a last resort, but it's not a guaranteed cure. Natural and lifestyle approaches. Diet changes, avoiding dairy, gluten, and processed foods may help. Exercise and yoga can reduce pain and inflammation. Supplements, omega-3, turmeric, and magnesium have been reported to help. A big question many women ask: will endometriosis stop me from having kids? It depends on the severity. Some women conceive naturally, while others struggle. Endometriosis can cause scar tissue and block fallopian tubes, making pregnancy harder. Fertility treatments like IVF may be needed. Surgery to remove endo tissue can improve fertility chances. Tip: if you're thinking about pregnancy and have endometriosis, talk to a specialist early. If you suspect you have endometriosis, here's what you can do. Track your symptoms, keep a diary of pain levels, period flow, and other symptoms. Talk to a specialist, a gynecologist who knows endometriosis can help. Explore treatment options, don't settle for, it's just period pain. Join a support group, you're not alone. Many women are going through the same thing. Endometriosis is real, it's painful, and it needs to be talked about more. If you found this video helpful, give it a thumbs up, subscribe, and share it with someone who needs to hear this. Have any questions? Drop them in the comments below.